It is from the air that the true scope of the damage in Haiti becomes clear. On the ground, a race to save lives as the hours stretch on. Prospects start to dim for people still trapped in rubble.
I was compelled to go. In fact, I was getting quite agitated listening to the news reports, knowing that I could help, and I had to go whether I was going by myself or whether I could find a group to go with.
When we heard that the earthquake had happened and we knew that we had people that had the skills that could help the people of Haiti, we started right away to organize through email and phone calls to see who would be willing to go.
At the time, it felt like it was the right thing to do. I mean, there's rarely an instance in which I've been able to help in a disaster such as this, and it just felt like the right thing to do, and there was a need, so I acted.
And right away the call was answered with absolutely yes, and then it became about how. So we set to work to talk to the hospital and then to talk to the folks at our union to figure out how we could get our first team of 11 people to Haiti.
Without the nurses union, it really wouldn't have been possible. The coordination and getting people there as quick as we did, with the assistance we had and the donations coming in, there were parts of it that were hard, but it came together when the time came, and within a few days we were on a plane down there.
The first team of 12 healthcare professionals left Burlington, Vermont and arrived through the Dominican Republic at the border of Haiti.
When I heard that, that our team had found the hospital in Himani and that there were many more surgeons and not very many caregivers there, and that they welcomed us to be there, that was awesome.
Kate Duffy and photographer Bob Davis spent a week embedded with the Vermont Haiti Relief Team.
Nurses volunteering with the Vermont Haiti Relief Team say the work here is unlike anything they have ever experienced.
It's been exciting and exhilarating and exhausting. I've never worked so hard in my life. There's just constantly people in need.
The number of patients, the nature of the injuries. It's a lot of work packed into their 12-hour shifts in the Caribbean heat.
But we were closing down for the night and we were turning down all the lights, and one of the patients began to sing rather softly, and we were just letting it go, like as if it was nothing. And you know, one by one, each patient on each side of them began to sing in this harmonious, beautiful song, and it was probably the most beautiful thing that I've ever experienced.
A young girl who had a spinal injury and developed a bloodstream infection and got very, very ill. I was able to bring some of my skills as a French speaker in addition to medical skills to bear, and spent the next half an hour speaking to her and making sure that all of her concerns were addressed. Her husband sought me out and said, "I will never forget you for what you did for me last night."
When a patient hollered to me, and I looked up, and here's this patient who hadn't been getting up very much. He had a new amputation, called to me so I could look and see him standing up, and then another patient that had an amputation and another patient that had an amputation were all waving at me and going for a stroll. That was an amazing joy.
The hard work that everyone put into the whole trip was amazing, and having groups from all over the world, not only just the nation, working with nurses from anywhere from California to Nebraska to Georgia to here. I do honestly believe that we made a difference, and I hope more groups can continue to go down.